Hello, this is Dr. Mehtab, second year resident Community Medicine Department, R&T Medical College, Udaipur. In the previous videos, we have discussed about barrier methods, intrauterine devices, hormonal contraceptive methods, and post-conceptional methods, and miscellaneous methods of family planning. In this video, we will discuss about terminal methods of family planning. It includes male and female sterilization. Female sterilization accounts for 85% and male sterilization accounts for 10 to 15%. Guidelines for free sterilization services. Age of husband should be in between 25 to 50 years and age of wife should be in between 20 to 45 years. They should have two living children at the time of operation. Age can be relaxed when the couple have three or more living children and accept declares having obtained consent from his or her spouse. Then male sterilization. 1 centimeter of vase is removed after clamping. Ends are ligated and folded back on themselves and sutured into position. So the curtains face away each other. Acceptor is not immediately sterile after operation until approximately 30 ejaculations. So sperm production and hormone output are not affected in this method. Sperms produced are destroyed by intraluminal phagocytosis. Complications of vasectomy include operative complications like pain and scrotal hematoma. Sperm granules appear after 10 to 14 days, which may cause reanastomosis of vas, spontaneous recanalization in 0 to 6% of the cases, and autoimmune response seen in some of the cases where antibodies against sperms are seen in 54% of the cases. Psychological complications like some men complain of impotence, headache, and fatigue. Failure rate is low, about zero point 0.5 per 100 years. Then post-operative advice for males. Patient is not sterile immediately. Use of contraceptives until aspermia is established. Then avoid taking bath for at least 24 hours after operation. Wear a T bandage or scrotal support for 15 days. Avoid cycling or lifting heavy weights for 15 days. Stitches to be removed on 5th day after operation. Then female sterilization, it can be done as an interval procedure, postpartum or at time of abortion. We follow two procedures which is laparoscopy and mini laparotomy operation. Laparoscopy. In this procedure, abdomen is inflated with gas and laparoscope is introduced into the abdominal cavity. Fallope rings are applied to block the fallopian tubes. Patient selection here 6 weeks after postpartum or immediately after MTP, and hemoglobin should not be less than 8, and no patient shouldn't have any medical disorders such as heart disease, respiratory disease, diabetes mellitus, and hypertension. Follow-up of the patient should be done by healthcare workers at 7 to 10 days after operation and at 12 to 18 months after operation. Then mini lap operation. It is a modification of abdominal tubectomy. Smaller abdominal incision of 2.5 to 3 centimeter is given under local anesthesia. It can be done at PHC level and mass campaigns. It is suitable for postpartum tubal sterilization. An evaluation of contraceptive methods, whether they are effective or not, it is done by Pearl Index. It is failure rate per 100 women years equal to total accidental pregnancies by total months of exposure into 1200. The National Family Planning Program. India was the first country in the world to have launched a national program for family planning in 1952. Goals of this program are population stabilization, reproductive health promotion, and to reduce maternal, infant, and child mortality and morbidity. Small family norm. Objective is to stabilize country's population at 1,533 millions by 2050. These are the norms given. Doya teen bus in 1970. Son or daughters, two will do in 1980. Second child after 3 years and universal immunization. These are the objectives given in 1980. Then Mission Parivar Vikas. It was launched in 146 high fertility districts: Bihar, Uttar Pradesh, Assam, Chhattisgarh, Madhya Pradesh, Rajasthan, and Jharkhand. Aim is to ensure the availability of contraceptive products to the clients at all the levels of the health systems. Then factors influencing population growth can be grouped into following three categories. Unmet need of family planning, 12.9 as per NFHS 4 in our country, and age at marriage and first childbirth. In India, 26.8 percentage of the girls get married at less than 18 years of age, and 6.1% of the total deliveries are among teenagers, that is 15 to 19 years. This data is as per National Family Health Survey 4. Then spacing between births, it is less than recommended period of 3 years in 50.3% of the births. Then these are the different family planning methods which are provided at the government centers. These include spacing methods like IUCD 380A, IUCD 375. Service providers are trained and certified ANMs and LHBs, SNs and doctors can be provided at subcenter and higher levels. Then injectable contraceptives MPA under Antara program. This service is provided by trained ANMs, SNs, staff nurses and doctors at subcenters and higher levels. Oral contraceptive pills. These will be provided by trained ASHAs, ANMs, NHVs, SNs, or staff nurse and doctors at village level, subcenter and higher levels. Condoms are provided by trained ASHAs, ANMs, NHVs, SNs and doctors at village level, subcenter and higher levels. Then emergency contraceptive pills are provided by trained ASHAs, ANMs, LHVs, SNs and doctors at village level, subcenter and higher levels. Limiting methods are the operative processes. Mini lab is provided by trained and certified MBBS doctors and specialist doctors. These services are provided at PHC and higher levels. Laparoscopic sterilization is provided by trained and certified MBBS doctors and specialist doctors, usually at CHC and higher levels. And no scalpel vasectomy is also provided by trained and certified MBBS doctors and specialist doctors at PHC and higher levels. In the next video, we will discuss about some MCQs of the family planning methods and we'll close this topic. Thank you.